capsule activity 5:16:24 initials AM. Right side, left side. The left side was ruptured implant saline from 2 months ago in March of this year. She had a left implant that ruptured. She was taking a shower, and that's when she noticed all of a sudden there was no trauma, no fall. And the right side, she had what is it, intact implant. I cut out the excess skin, as you can see. Now, as you will see, we'll do the right side first. It's relatively very thin capsule. The entire implant capsule has been removed as one system underneath the muscle. And as you will see, these are the one and only set that she's had. You can see how thin this capsule is. No matter how thin, it has to be removed. That's the goal of the whole operation. Anyone can remove an implant. The whole capsule must be removed sincerely, definitively. And as you will see right here, I'm going to go ahead and pull this out. Saline implant. It's intact. We know the whole it's intact. Otherwise, if it ruptures, it's like a water balloon. It will rupture. Now, there's some fluid on the back of it. And if I go, you see this? This is your gel, the silicone that's leaching out, even the small amount. This is your Allergan 425cc implant. So this is intact, slightly overfilled, but you saw that, and you will see, look how thin the capsule is. No matter how thin, you can see it's actually transparent. You can read right through it. The entire capsule must be removed. And overall, there are some areas that are thick, as you can see. Now, if I flip this around, all of this tissue has to be removed. And so overall, I'm very happy how the whole dissection has gone. Now, I was dissecting on the left side. This had collapsed on itself. I'm going to remove my top layer of gloves. So as I was dissecting, you will see there was a small break. Now you can see, look how pointed this is, because it's like a IV, like a basically, or a saline that has collapsed on itself, and you can see it triangulates, and we'll see what's on the inside. So some patients feel like this poking through on the skin. Look at this corner, look at this corner. It triangulates over here, this corner, it's collapsed on itself. Now, as I was dissecting, you will see there was a break in the capsule. So what I did was I just took a suture and I reinforced it. And in the middle, what I did was I took this angiocat catheter and I aspirated some fluid. So it's not uncommon to see this part of the saline. If I go like this, you can see it's slightly viscous. You can see how the meniscus forms. It is viscous. So what I'm going to do now is I'm going to go ahead and open it up, and you will see this is what the patients feel on a ruptured saline implant, these pointy edges. And as I go in, and I'm going to remove it just like the way it was sitting inside. So here it is. So I'm just going to just place it out so you can see how it was actually bent like this. So it was sitting like this, and you were seeing all these pointy edges. And as I go in, you can see the capsule again. It is collapsed on itself, and all of the capsule has been removed. Remember, that's the whole goal of the surgery. And then we will see how it's going to unfold. And usually it's a valve problem. And we'll see if I can find out where this break is. Now, it's hard for me to see where it is. But what I'm interested in, there's some fluid on the inside. Now, it's not uncommon to find fluid on a saline implant because it couldn't go out into the body. The body absorbs it. And as you go in, I'm trying to look at the valve. The valve looks good. And I'm not able to see where this break is. Now, what I'm going to do is I'm actually going to cut right here. I want to cut because I want to collect that fluid. I'm going to send it off just to be complete. Remember, any fluid around is so this fluid, I'm going to go ahead and send off to cytology to rule out the BIAL, CL, CD30 analysis. So the implants will be returned to the patient, capsule sent to pathology, rule out the BIA, ALCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal. And most importantly, we'll see how the patient bounces back from her symptoms, whatever she had. We'll see how she's going to do. So there you have it. This is Dr. Khan, Executive Plastic Surgery.
So,